Welcome back to Synchronicity Talk Radio for your mind, body, and soul. I'm your host, Marie Bernard, and we are speaking with Dr. Loren Corman. He is from the Vancouver Psychotherapy Center, and we're just talking right now about borderline personality disorder, which is what originally dialectical behavioral therapy was intended for. So what other things is DBT being used for now?
It's a big one. It's been... There's some evidence actually supporting its use with folks who have problems with binge eating disorders. And there's some research by our group actually, like a randomized control trial data, showing that the treatment and adaptations of the treatment work well for people with anger problems and sometimes also people with anger and substance use problems. And the research also was extended for people with borderline personality disorder and substance use problems in a couple of research trials. The research, even though there isn't a lot of research supporting this, the treatment's also been extended for work with adolescents and their families, particularly like suicidal impulsive adolescents and their families.
So how is a suicidal adolescent different than someone with borderline personality disorder, which you just said one of the big red flags for BPD is that their suicidality?
Well, I guess it's a good question. It raises the whole question of what a personality disorder is. A personality disorder, at least if you look at the psychiatric, the DSM, the Diagnostic and Statistical Manual for the American Psychiatric Association, the idea of a personality disorder is that the person really has problems that are pervasive, like that are long-lasting. And so when working with adolescents, they're really usually too young to make any kind of formal diagnosis of personality disorder, because you see problems in youth and young adults that are sometimes they're just kind of age appropriate. You see much more impulsive behaviors in youth, but even when a young person becomes suicidal, it's a bit usually too early to label the adolescent as having a personality disorder. So you want to actually see the behavior hopefully not occurring over a longer period of time.
Thank you. And so what is the difference? Maybe we could talk about what dialectical behavioral therapy looks like. Now, it's similar to cognitive behavioral therapy, which I'm sure a lot of listeners have heard of. So what's the difference between dialectical behavioral therapy and cognitive behavioral therapy?
Yeah, so it's similar in some ways, and it's very not similar. It's very dissimilar in other ways. The cognitive behavioral therapy focuses primarily on changing clients' ways of thinking, and to some degree also focuses on changing people's behaviors. DBT focuses much more on clients' emotions first. So in DBT, there are in a comprehensive DBT, there are four main components of treatment. Clients undergo individual therapy, but it's primarily skills-based. So clients also they participate every week in essentially a classroom where they learn skills. And they learn skills focusing on emotion regulation, on being mindful, learning how to be here and now in the moment, to make decisions based on their own wisdom, to be able to be non-judgmental, to be able to see things as they are rather than kind of see things through the prism of their own opinions, to be able to be more interpersonally effective, to be more assertive, and to be able to tolerate their own distress, to be able to get through painful life events without making things worse. But the focus really is much more on being mindful and learning how to tolerate emotions and how to regulate or even modulate or change emotions. And that isn't really a focus of cognitive behavior therapy. One of the reasons that Marshall Linehan originally thought that CBT was not a really good match for people who were emotionally dysregulated was that a lot of the folks about 75% of people who meet criteria for borderline personality disorder have some history of abuse. And often that's associated with being told that reality is a certain way, and being that in a certain way, I guess reality being foisted on them in a certain way. And so because CBT really focuses on helping clients change how they think, the idea is that, well, first help people regulate their emotions first, because when your emotions are really frazzled, it's really hard to kind of think clearly. And so, two things. One is that it's hard to kind of go back to people who've experienced really invalidating childhood and tell them actually to change the way that they're thinking, number one. And number two, when the folks' emotions are really frazzled, the first thing that really needs to be addressed is getting their emotions under control, because it's like a fire alarm system. It's hard to really to do anything else. Emotions really they grab our attention, and they really focus people's behaviors and attention very, very intensely.
Thank you, Doctor. I don't know if I should call you Dr. Lauren or Dr. Corman. Lauren? Okay. So I'm curious now, people who have borderline personality disorder, like you said, it's very pervasive. This is going on a long period of time. It's really affecting all aspects of their lives. But what about people who, like, as an example, would listen to this show and are looking to have more regulation over their emotions, have more control over their thoughts? A lot of times in the New Age spiritual world, there are things like affirmations and meditation. So how can DBT type skills help people who might not have personality disorder but are still struggling with the regular daily? Because for me, it seems kind of confusing when you talk about feelings of like emptiness and stuff. A lot of people in the world have those feelings, and they don't have personality disorders.
Absolutely, that's absolutely true. Well, I mean, one thing is that DBT is, in large measure, DBT is not necessarily an original therapy. Marcia said that one of the things she did was she cobbled together pieces and parts of different therapies and different, even mindfulness, which is really not necessarily wasn't before primarily a therapeutic method, were taken and kind of cobbled together to form something new into a new form of therapy. There are lots of parts of DBT that are useful for folks who, as you said, may not meet criteria for borderline personality disorder. And it's not that they have to actually do DBT at all. I'm not shilling DBT for the masses. It's just that things like learning how to actually, for example, act from wisdom, or even meditate, which is now becoming actually much more prominent part of DBT mindfulness practice, are going to be useful to people regardless of whether or not they meet criteria for personality disorder.
And now I'm also curious, the emotion regulation, the mindfulness, the interpersonal effectiveness, and the distress tolerance skills, these are they seem like some of the most basic skills. Yet, I mean, I've been in dialectical behavioral therapy for a couple of years now, and I didn't get these skills growing up. And I actually come across a lot of people now that I have all these skills. The frustration is that a lot of people in the world don't have these most basic skills. So one of the reasons that I wanted to do this show is to shed light on some of these skills and how people can get access to them, and whether DBT or CBT or some other type of therapy might be helpful to them. I'm just wondering what your opinion is on why these skills aren't being taught just openly in the world.
Oh, I think that's a really good question. I mean, I think to some degree, I didn't get taught these skills either when I was a kid. And I think that to some degree, some of these skills are imparted by parents just in normal, healthy upbringing. These skills are imparted by parents to their children, and they're not necessarily conveyed as skills. So, for example, a few years ago, I was visiting a friend and his young son. His kid was crying, and his kid wanted to play with, his son wanted to play with a screwdriver, and so my friend took the screwdriver away, and his son got more and more upset. So the son stood by his kid and said, hey, I know you're really, really upset. You still can't play with the screwdriver because you're going to hurt yourself, and why don't we just sit together and until you calm down. Well, that isn't necessarily thought of as skill, it's good parenting. But just by that communication, his son is actually going to learn how to regulate himself, right? just by sitting next to his father is soothing him. There's a lot of modeling that's taking place. Plus, the kid is learning how to regulate himself in the moment. That often isn't the case, particularly in environments that are functioning less well. So where parents might either not be around as much, or whether they may, be struggling on their own. And so some of us learn these skills, some of us don't learn these skills, unfortunately. Some of us may be coming from really functional backgrounds and still not learn these skills and still need them.
Wonderful. So I'm curious how your life has changed, because I know with the therapists that I've been working with using DBT, that they often say to me, like, oh, I've used this skill and this really helped me. And until they learned it, until they started teaching it to their clients, it wasn't really a full part of their life. So how has teaching and using DBT in your practice helped you?
I think it really has. I think the skills, again, they're not just DBT skills, but I think these skills have helped me a lot. Like I said, I also didn't learn these skills growing up. I think I knew some of these skills, just not by any formal training from my parents or anybody else. But I think, for one thing, learning how to radically accept. There's this idea in DBT of radical acceptance, radically accepting things that you can't change that are painful and hard, either that are happening now or that happened in the past. Now, it's a very difficult kind of concept for people, including myself, to fully digest, but the idea is that when people can radically accept very, very painful events, that it doesn't take the pain away, but it may reduce suffering. And so that idea, or that concept, or that practice has been incredibly important for me, I think particularly in the last few years, going through very painful life events. I think most DBT therapists have mindfulness practice, and you'll find, like you do with your therapist, that most DBT therapists, I think, are walking the walk. Psychologists used to teach clients, I think it was really important to express, in the 60s and 70s, it was really important to express what you feel and to act on feelings. Now, actually, we're learning that, for example, if you want to get anger down, anger doesn't come out. The way to reduce the intensity of anger is actually to not act on it, or to actually change anger into feelings of warmth. So, for example, if I'm angry, if I'm really angry, you will find me smiling. One of the ways that I know, my wife is Buddhist, and one of the ways I can reliably tell that I've done something that would have bothered her is that I will find her doing a little half smile. And I know, even though she didn't formally learn that skill, that's a method that she's got to kind of re-regulate herself, I think, that she's actually changing anger into calmness.
So that's interesting, Lauren. I want to talk more about these emotions and how we can change them, and what you said about anger, how getting it out, because some therapies would have you like hitting something or punching something. So it sounds like you're saying that actually doesn't get rid of the anger. In fact, it can help it to build. Part of the therapies that I learned growing up were like that. We were taught to help clients smash a chair with a whipple bat. And it's not that there's no usefulness to that, but the usefulness of that kind of emotional expression was way overstated. And for people who are very, very inhibited, for example, a person who's very, very who's been dominated by their spouse for 20 years and who's never expressed any anger, helping the person to direct, focus, experience, and direct their anger in an appropriate way, right, in a non-abusive way, is incredibly helpful to somebody in that kind of situation therapeutically. But for people who are angry a lot, doing that, getting them to express more anger, is quite unhelpful. So, for example, there was this belief before that, you smash
what do they call those Bobo dolls, those blow-up dolls? Smash a Bobo doll, or take a wiffle bat and smash a chair, and that you could get anger out of you. I mean, it partly came from the psychoanalytic concept years ago, but there really isn't there isn't scientific support for that. And so when people express anger, they activate the parts of their brain that are associated with more angry thoughts. They will begin to have more angry thoughts available to them, and they will feel angrier. So expressing an emotion tends to beget more of that emotion. If people want, it's all up to the person, right? So it's not that we're trying to change people against their will. But if people are coming into therapy with saying, hey, I'm angry a lot, and I want to get less angry, one of the ways to get less angry is actually to express the opposite emotion, to express kindness or warmth or compassion, or in the worst case scenario, to kind of retreat gently from the situation. I ran an anger clinic in Toronto for many years at the Center for Addiction and Mental Health. Many of our clients who came into the anger clinic, the anger and addiction clinic, thought that they need to express more anger. But that's why they were there in the treatment in the first place, because they had such huge anger problems. The problem was that they actually didn't know how to re-regulate their anger.
Interesting, Lauren. So I'm confused now about the anger, I guess, because sometimes it's important to express your emotions. So it sounds like what you're saying is that you don't stop yourself from feeling the anger. I guess there's different techniques, right? Because there's sometimes you might use opposite emotion. So you would do an activity that creates a different emotion in you, the opposite of what you're feeling. But there are also times when you would just sit and notice the emotion, correct?
Absolutely. Really good point, yes. So the important thing is, first of all, is for the person to even be aware that they're feeling angry, right? So the skill that's focused on helping people be aware of what they're feeling is mindfulness. And so some people are aware that they're angry. Some people express anger without even being aware of it. I remember a person in our clinic in Toronto who was raging and angry, screaming, I'm not angry, I'm not angry. Half the hospital was in the corridor shaking their heads because this person was raging. But he wasn't lying. He really didn't know that he was feeling angry. That happens. So it's a matter of, first of all, being aware of what you're feeling, number one. And it's hard, right? And then being able to have some control over the emotion so that the emotion's not overwhelming. And then figuring out whether or not to express it and how intensely to express it. So obviously just because you're angry at your boss doesn't mean that you go and express it every time, right?
Well, my next question, Lauren, is about, because isn't anger a secondary emotion? So couldn't someone who is raging, as you described, not realize that they're angry because really they're really sad and hurt and frustrated? And so all of that combination is what's anger.
So anger can be a primary or a secondary emotion. So you're right that anger sometimes is a secondary emotion. I'll explain the difference. All human beings on the planet are born with a propensity for experiencing and expressing anger. It's one of the things that really defines us as human beings. So regardless of where you are on the planet, doesn't matter if you're in Japan or Canada or in some jungle in the Amazon that has had no contact with other folks, people will tend to make the same faces regardless of what culture they come from. So, and they'll make the same faces in response to the same situations, and we think that if they're basically experiencing the same types of emotions like anger, sadness, fear, joy, love. Some people argue that disgust is a basic emotion. Some people argue that shame and guilt might be basic emotions. But sadness, fear, anger, joy, love, there's no question about. All human beings have the propensity to experience or the ability to experience and express those emotions, and all human beings make the same faces. And their bodies tend to respond in similar ways when they're experiencing and expressing those emotions. So when people are angry, they tend to attack or repel. When people are sad, they tend to cry and or withdraw. When people are afraid, they tend to flee or avoid, right? And so on. Now, when a person responds to an event of violation, when they've been violated and they express anger, so when somebody, when you think of our ancestors, and imagine somebody living in one of our ancestors living in a cave, and somebody came to steal their fire and their food, our ancestors would have been mobilized by anger to get up, to grimace, to maybe pick up a rock and go and attack the person who was stealing their food. That's actually highly adaptive. It would have kept our ancestors living and procreating. And so when it's expressed in response to violation, it's considered a primary emotion. When a person expresses sadness in response to loss, it's a primary emotion. When somebody expresses fear in response to a threat, again, it's a primary emotion. Primary because it's helpful, it's adaptive, it keeps the person alive, it helps the person maintain their well-being and the well-being of people they care about. When people respond with a different emotion, then it's a secondary emotion. So, for example, if you've been violated, but you express sadness, or if you've experienced loss, if your boyfriend or your girlfriend says, hey, no, I'm not so happy in a relationship anymore, I'm thinking about leaving, right? So it's a loss situation, and you start raging, the person starts raging at their lover. That's secondary anger. It's a secondary reaction, and it's almost never useful. And that is often what you see, the kinds of problems that people come into therapy with are often related to secondary emotions. We teach our clients about emotions. We teach our clients about primary and secondary emotions. And we try to help our clients respond appropriately to emotional events. Of course, just because you're responding with a primary emotion doesn't mean that you're responding with the proper intensity of the emotion.
So thank you for that, Lauren. And now let's talk about also, you had mentioned that DBT was helpful for people with eating disorders as well as people with borderline personality disorder and also who have an addiction. What about people with just a general addiction?
I wouldn't send somebody for DBT if they just had an addiction, just because DBT is a pretty serious commitment. It's a comprehensive treatment involving usually 2 hours a week of skills training and an hour of individual therapy, plus all the therapists who are working on a team will meet together for at least an hour, if not 2 hours a week, for a consultation team, plus there's after-hours coaching. So that kind of intensity of treatment isn't going to be necessary for most people with addictions problems, and there are other treatments that have a lot of scientific support that you probably want to go to first. Some people who have, as you said, personality disorders or borderline personality disorders and co-occurring substance use disorders benefit from DBT or adaptations of DBT called DBTS.
Oh, what is DBTS?
It's just, there's little mini acronyms that DBT folks have put on after DBT. So DBTS is DBTS is DBT for substance use. So there are a number of adaptations and skills in the treatment for DBTS. So, for example, there's a hierarchy of targets in DBT. So, DBT therapists always first focus on life-threatening behaviors in therapy. Then they focus on anything that interferes with treatment. And the third thing is they focus on anything that interferes with the quality of clients' lives. In DBT for substance use disorders, the substance use disorder is the first quality of life interfering behavior that gets priority. So after life-threatening behaviors and therapy interfering behaviors, therapists will focus usually then on substance use behaviors.
And Dr. Corman, when we were talking on the phone a few weeks ago when we were scheduling this interview, we had talked briefly about depression, and you had said that depression, specifically, you wouldn't actually prescribe DBT. So what kind of therapy would you prescribe for someone who has some kind of generalized depression?
Well, probably, again, it would be one of the therapies that have scientific support, so probably cognitive behavioral therapy, interpersonal therapy, emotion-focused therapy has scientific support behind it. Probably one of those therapies. I would definitely, if it was not a psychotherapy, I would want to look at the possibility of pharmacotherapy. And of course, if somebody was depressed, you want to make sure that they had a full medical screen first to make sure that there wasn't some medical condition that was contributing to them being depressed.
Thank you. So now, since the main topic of today's show is dialectical behavioral therapy, I was thinking that maybe we could go into some of the specific skills, if you're able to do that. So, okay. So I guess maybe, what do you usually start with? Emotion regulation?
Typically, it's mindfulness. Typically, mindfulness is it's the core skill. So all the other skills really are based on mindfulness. They don't work without mindfulness. And mindfulness gets the most airtime in skills training groups.
And so for me now, I work really hard at being mindful. And I notice that I'm able to be mindful of my emotions, and I'm able to recognize them and define them and identify them. And yet at the same time, I still have this, I'm still in the habit of, okay, I'm really feeling sad. I don't want to feel sad. And then I guess part of mindfulness is non-judgmental, right? But I tend to judge my emotion, and that often gets me more worked up because I recognize how I'm feeling and I don't like how I'm feeling. So what would you tell someone who's doing that behavior?
I'm not sure exactly what I would say. I think, can you repeat what you said?
Sure. So for me, I will recognize the emotion. Typically it will be sadness or frustration or a general overwhelmed feeling. And I'm mindful of it, but then because I recognize the emotion, it's an unpleasant emotion. And so I feel like I don't want to feel this emotion. And that's when my thoughts kind of get carried away, and I'll end up feeling worse and working myself up rather than using some other technique to allow it to pass. I sort of push it away or try to push it away, and that just makes it worse. So I'm wondering I'm wondering if you ever do this to yourself, and also what advice would you give someone who does that? Because I feel like that's pretty common.
Thanks for clarifying. So I think one of the main ideas, one of the things in dialectical behavior therapy is that it's dialectic, that for every idea there is an opposite idea, and that life is lived in the balance between these two opposite ideas. And so if people are feeling, if people are having difficulty tolerating intense feelings, one important thing is to actually focus on distracting attention away from painful feelings. Right? So when feelings get overwhelming or they're just too unpleasant to tolerate in the moment, one of the main ideas in DBT is to teach people how to mindfully bring their attention away from the situation, away from the feeling, away from the bodily feelings that are associated with painful emotions. So, for example, you might do things like generate opposite emotions, or soothe yourself by jumping in the shower, or plunging your arm into a sink of cold water, or by lighting candles, or smelling essential oils, which are a way of actually powerfully bringing people's attention away from whatever is happening in the moment, right, to something else. And where attention goes, typically mood follows. Now, that is one strategy, which is a change strategy on the one hand, to, on the other hand, actually learning how to better just tolerate in the moment painful emotions. So learning how to fit with emotions without actually doing anything about them. But the funny thing is that as people learn ways to mindfully distract from pain, what typically happens is they're less freaked out by painful emotions. And so, you know what I mean? Like, the more people can kind of know that they can reliably get away from painful emotions, the more they're likely to actually sit with pain. Because the thing about emotions is they come and they go. And so people get, sometimes people get really freaked out, understandably, or they get really upset because when you're in the midst of feeling strong emotions, they seem like they're here forever. Mm-hmm. But even the most painful emotions don't last forever. They come and they go. They're like the tides, right? They roll in, they roll out. And when people finally kind of learn that emotions they're temporal, right? All emotions are temporal. I think that what happens is they're less scared by them. At the same time, you got to also have strategies for getting your mind away from pain so that you're not feeling completely overwhelmed by it.
Thank you, Lauren. So what comes up for me is that I get into, like, even though I have all these skills, and anyone I would imagine who's listening to this show would be pretty up to speed with skills and mindfulness and all of that, but it really is the practice, because when you have an overwhelming emotion come up, you're not in part of the dialectical behavioral therapy is the logical mind, the emotion mind, and in the middle there's the wise mind, and the goal is to be in the wise mind more of the time than just living out of emotion mind or logical mind. But how do you, when you're in that emotion mind, I mean, you've got all of these hormones and things rushing through your body, so how do you stop yourself from being in emotion mind and getting yourself into wise mind?
Well, the idea, first of all, is that the person is always there. So the more you can actually, even when people are in emotion mind, teaching clients to learn to be reflective of the fact that they're in emotion mind. So, for example, clients come into therapy, they may be really dysregulated, they may be dissociative, but in the beginning of therapy, they may not even be able to reflect on their experience. So they may be just raging or really, really upset, or really afraid, and just be out of it, essentially be, kind of pulled away by the undertow of their emotion. Over time, getting people to be more mindful, even if they're not in wise mind, helps them to be able to reflect on, to take a step back and to reflect on what's going on. So, for example, a person then will say, boy, oh man, it's like I am really in emotion mind right now. I'm so angry. But even being able to be aware that their emotions are so intense, like the rest of us, and that at that moment it feels like their behaviors are being kind of ruled by their emotions, is one step away from kind of being pulled away by the waves of emotion. Do you know what I mean? And so, first of all, it's a matter of just reflecting on what's going on. And it may not be possible for a person in the moment when they're intensely in emotion mind. It might not be possible for the person to switch into wise mind. At the same time, they may be able to act wisely. We used to run anger groups at CAMH where people would be really, really angry. Something would happen, they'd be really angry, they would be on the verge of leaving the session, and one of the therapists would say, I'm wondering if you could would you be able to even click into wise mind just for a second as you're leaving? And sometimes people would just stop in the doorway. I mean, it didn't mean that their emotions, the intensity of their anger, suddenly, disappeared. But it did mean that they were there, like the person was fully there, and they were more than just their emotion. And that is one of the key messages in CBT. And that is that emotions are really important, they're really helpful, but we as human beings are not our emotions. And when we're in the midst of feeling things really intensely, it feels like we are our emotions. And when we feel like we are, our whole bodies and souls are our emotions, then it's really, unfortunately, easy to kind of be carried away by them.
So Lauren, now I'm curious, we have emotions for a reason. So there's a purpose for the fact that when we have an intense emotion, we tend to act from that emotion rather than our logical mind. Isn't it a survival instinct?
Absolutely right, it is. When it's functioning properly, it is. So the reason that if we didn't feel sad, you're absolutely right. When babies don't feel sad, they don't cry, they don't get nurtured by typically their mothers, and they don't thrive, or they die, right? When people don't express anger, they are unable to actually stand up for their rights, and they don't thrive. When people are not afraid, you know what happens, right? They die, right? They're not able to back off of dangerous situations, right? You see this even with physical pain, right? People who are born with some anomaly who are unable to experience physical pain, we think, that's fantastic, but it's not fantastic, it's awful, right? They'll play hockey and they'll, rather than kind of move, once they get whacked on their knees, rather than move their legs away, they'll keep their leg open and keep their leg extended and will break their leg. So you're absolutely right. Emotions are incredibly important. They're highly adaptive. We tend not to survive without them, and they've been evolved over the millennia for good reason. But it doesn't mean that they can't misfunction, and particularly unfortunately, when folks are either really born extremely sensitive or vulnerable to negative emotions. So, for example, some people are just feel things more intensely, or it takes very little to get them going, or maybe it not only does it take little to get them going, but it takes a long time for them for their emotions to return to baseline, or because of some kind of learning that's taken place. So, for example, we think about a neglect or abuse, people's emotions can become quite dysregulated and work against them. See this, unfortunately, with people, right, who are overwhelmed by their sadness, or they've got one gear, unfortunately, and it's anger. So they're angry all the time. You don't see sadness, you don't see fear, you don't see love or joy or vulnerability. You see anger all the time. And those kinds of examples, for example, it makes sense if somebody's been violated repeatedly when they've been a child, over and over and over and over. I'm not saying all anger problems are the result of being violated as a child, but if you've been violated over and over and over, and you've been told you don't have a right to express anger, well, the moment you have a chance, you're going to tend to be expressing a lot of anger. And so the world is a very violating place. But as an adult, it tends not to be a very functional way of being. Around you if you're angry all the time.
Exactly. Well, it's time for a break now, so we will be back with more Synchronicity in a moment. This is Synchronicity, talk radio for your mind, body, and soul. Today we are speaking with Dr. Loren Corman. He is a psychologist at the Vancouver Psychotherapy Center, and we will be back in a moment. But if you want to get on the air and ask him a question, the number is 604-822-2487. That's 604-822-2487.